Briefly, maternal death is when a mother loses her life while giving birth. And that is what maternal death simply means. And then infant mortality. This is the kids. Either they have died in the womb in the process, or they have come out but still they die under 5 before they reach 5 years of age. That is infant mortality. And then there is also a term called perinatal death. That one exactly happens when a kid is born dead or is dead at the point of birth. Now, coming to these two terms, I would like to give statistics of what exactly happens. Why is it a problem? We could as well call it as a pandemic in West Nile region. Reason being the statistics are very alarming. If you take the statistics for the financial year of 2023-24, you realize that we lost, as West Nile, we lost 736 women while giving birth. And these were due to complications, and also we can't rule out negligence. That is when we lost their mothers at the point of birth. And of course, after others, they give birth, but because of bleeding and other complications, they still die. And those ones, we still consider them, they died as a result of, we refer it to maternal mortality. I have said 736 per 100 live births. And now, when we go to the national figure, the average figure for national level, it is 368 per 100. That is when they add all the figures in every region, it comes to 368. But West Nile alone has 736. That is what I just wanted us to understand. When we come to infant mortality rate, it is worse than the maternal death that we are talking about, because one of the reasons is that there are challenges with mothers not attending antenatal clinics, and there are challenges with the healthcare professionals working on these mothers to ensure that they give birth safely. But it is a collective challenge on both sides. It is not one-sided. So as a result, you see that we stand at 54%. That means we lose about 56 children while giving birth in every 1,000 kids born. And we stand also at 54%. We are above the average of the national, which stands at about 40%. Now, some of these challenges are not just because our mothers are careless or because we come from a region where we are stricken by poverty, but some of the reasons are attributed to access to healthcare services. You realize that in West Nile region, we have about 75.6% of the population lives within 5 kilometers of health facility. And yet many do not utilize these services due to barriers such as lack of information, transport issues, and cultural beliefs. As much as some of us have access to these health facilities, we don't make use of them. And then we have communities that are actually over 10 kilometers to the nearest health facility. In that, when a mother is at labor, she is prompted to give birth from home other than going to the healthcare facility, which is about 10 kilometers or more than that. And also we have the cultural beliefs that is making our mothers to give birth from their communities other than going to the hospitals. As a result, when we seek for healthcare facility, when we seek for medical service, after giving birth from home, you realize there will be more complications giving birth from home other than giving birth at the hospital. So now when they reach the hospital, the complications are worse, and you realize at some point, of course, we lose this mother or we lose the child, yet they are not supposed to be lost. And I can say this without fear or favor that in West Nile, we tend to blame doctors more than taking personal responsibility on what we should have done as a parent or as a friend or as a colleague to this person who has given birth from home or who has prompted to believe in cultural or religious stuff other than going to the health facility. You realize also we have few mothers that attend antenatal care fully. It is very hard to find in West Nile region, that is according to statistics, that our pregnant mothers attend antenatal clinics more than 5 times. Yet, currently we are supposed to do a minimum of 6. At least 6 we would have tried, but it is what is lacking in West Nile. Also, we can't rule out the fact that we have some high prevalence of HIV rate in the West Nile region, which is about 6.4%, and it is an implication for maternal and child health, something that needs to be addressed. And lastly, I would say and emphasize on this that it is limited health education that is affecting us as West Nile region.